Action.
Action. So, we're going to perform these lumbar spine views. We think a minimal diagnostic series is an AP, or a frontal view and a lateral view. Some people say PA projection for females of childbearing age, but we think that an AP projection is sufficient, and the protection for the patient is to take a good film the first time. The AP and lateral are the minimal diagnostic series. We could have optional views added to that. Most commonly we're using the AP axial, which is a good look at the lumbosacral joint, the SI joints, and we could also use a lateral of that same joint, an L5 spot that in some cases is not sufficiently penetrated on the lateral, initial large lateral film. Or we could do obliques, and for these obliques we generally use 11 by 14 films because they don't need to include all the hips. We use AP lumbar films on 14 by 17 for the evaluation of leg length and and it doesn't really show the SI joints well. So, and now we're setting up our film here inside of 17 and 12 inches, and I don't know where my patient's going to be standing, but I do know that she's going to be facing out this direction, so I'm putting this marker in the middle of the film, somewhere where I think it's going to be not in the way, and that's going to be centered at the iliac crest. And unless she's 9 feet tall, this isn't going to be at her iliac crest. But now you see I've got this field set up so that now I could just bring my patient into this operation here. I will take a measurement of we're going to take all of our measurements first. Measure the AP through the level of the iliac crest. We're going to measure the lateral through the level of the ASIS, and this will assure us of getting a better look at the lumbosacral joint. If we measure through the waist, it might be the lumbosacral joint area may be a little bit underexposed. So we're going to do like this through the ASIS for the lateral, but we're centering both of these AP and lateral films at the iliac crest. It's one of the exceptions where you don't measure the path of the central ray. Then we're going to measure the axial view, and we would measure that at a 25-degree angle because through the level of the ASIS, because that's the way we're going to be shooting it, 24 centimeters or so. And then we're going to measure this. We're going to measure this oblique lumbar at a 45-degree angle because that's the way the path is going to be traveling through, and it's going to be about 1.5 inches or so above the iliac crest, so we're going to call it maybe 23, 24, something like that at a 45-degree angle. So we set our first technique, which would be the AP, and of course we've had our patient remove her shoes and all metal objects that are in the area of interest, and that would include any sort of bra, belts, zippers, buckles, that kind of stuff. And now she's coming over here, and so the three things. So here we have certainly a place to put this central ray. So I will find this iliac crest, and I'll just, remind you that the iliac crest isn't out in the front, it's in the middle, okay? So you have to walk around to like mid-axillary, you put the line to the crest, and then put the film to the light. And I like this compression band, so I'm going to put it on here, and this takes out some of the lordosis. And some low back patients actually like this, you know? Haven't they said that to you? And make sure that she's not twisted up from this compression band. Spread the feet apart just a little bit. That's nice. Nice, straight, centered midline at the level of the iliac crest. We're going to add breast shield. We're going to add, well, because the patient, we want to care, so we care. And there. And I did put a film in here. And that's our AP lumbar spine. We have our patients suspend expiration, so take a breath in. breathing. Don't move. Beep. Breathe. That's nice. Okay, we're just going to do our diagnostic series here first. Actually, for convenience sake, I think we're just going to do the lateral next because it's the same size film and the central ray is in the same location. And here again, we're having our patient stand straight up, make sure the spine is really lateral. She's in contact, but definitely not leaning in toward the board. Feet are shoulder width apart. The central ray is at the iliac crest and just posterior to the mid-axillary line. And no reason not to use shielding for female patients on this one because the structures we're trying to protect are decidedly anterior to the ones that we're trying to image. And we're going to put a left marker on that. And I'm not sure that I'm using it. Whether it's actually protecting anything or not is questionable. But anyway, let's have you take a nice and deep breath in and let that out and stop breathing and don't move. And while we're in this nice lateral position, we're going to do the L5-S1 spot lateral film. Well, where is the L5-S1 joint? Let's see. The crest is L4-5 and then ASIS is about S1 or so I'm guessing it's about there. Is that about right? And so that's the light to the patient, and we're using an 8x10 film for this one, and collimating to less than the film size here. Make sure we got a good lateral here. Again, we can put some shielding here. Position this marker so it's actually in the field. Make sure we got a good lateral, and I'm liking that. No particular breathing instructions for this, but just stop breathing, don't move. An increase of about 10% kVp and maybe 50% MAS is necessary to change this technique. Beep. Okay, now let's go to our axial and our obliques. So we'll turn this way, and we're going to do an AP axial. We use a 25-degree cephalic tube angle, and that would necessitate a 5-inch decrease in SID, but since we're already at 40 inches here, we can't do that on this unit, so we're going to have to just increase our MAS somewhat. And we measured her so we could use this chart. This is a 10x12 film placed in here crosswise. And we find the ASIS and the iliac crest. And this is coming up about there. Come slightly under the ASIS. We put this light to the patient, put the film to the light. I'll bring it back down. No particular breathing instructions for this one either. And once we've got this all positioned, we could do this too if we want. That's nice. And make sure to not twist it up. That's nice. Beep. Okay, that's nice. Breathe. If I told you to stop. Then these oblique views. Oblique views of the lumbar spine show the zygapophyseal joints and the pars interarticularis. Posterior position, which are AP projections, show the side nearest the film. So maybe you could just step out for a second, please. Thank you. Using 11x14 films here. And I'm just going to put one marker on here for both of these views. I'm doing AP projections. So let's start with the RPO position. That's the body is 45 degrees. Bring your fist foot forward, so no. So here, see the line, see the square? You make yourself half that. There, that's nice. That's good. Okay? And this line should be in the middle. Okay? And we've already measured for technique, we measured in this way, the path of the central ray like this. But what I'm suggesting here now is that you just see this plane. If her entire thickness is, say, 26, 27, that this line should be about 13 or 14. I see that this line is too far this way, and we're going to move her a little bit that way. Now I see this line being straight up and down the spine, and we could at least protect the other side if we wanted to. This doesn't move my way. Yeah, that's nice. Okay, this is the RPO position that shows the right C joints and the right pars. We could have the patient take a breath in, let it out, stop breathing, don't move, and we would do the LPO with that. And as I said, some people advocate doing PA projections, so let's just demonstrate that while we're here. I'm going to change this right marker over here now. It could have stayed there for the LPO. Now we're doing this and the same sort of thing. Yeah. Sorry. Some respects it's a little easier because you can feel where the spine is, but the spine is quite a distance now from the film, and in the PA projection you're rolling the spot, the area of interest away from the film. So my take is the PA AP projections image the joints and structures better. Take a breath in, let that out, stop breathing, move. Cool. Right? AP lateral minimal diagnostic series. Third view is AP axial, or the L5S1 spot, or an oblique, or two obliques. Thanks. That's